out your mouth.
All right, we are back. Martin Foss here. We are with our dental expert here on HTV, and what a great dentist he is. He does a lot of things in the community. Dr. Ron Walker, good to see you again. How are you?
Good to see you, Martin. I'm doing great.
All right, so we see on TV all these movie stars. They go in these shows and they got perfect teeth.
Yes, sir.
And then you see them on YouTube on previous shots and you go, ain't the same person. But today we'll talk about teeth fixing, I guess, for lack of a better word, but aren't there mainly two common approaches to this?
Yeah, so today we'll talk some cosmetic dentistry, right? This is to help people out that just want to have a little better smile, a little better confidence. Some people are born with, some staining of the teeth that you can't get rid of. You have to mask out. So one option for you is going to be bonding. You can do that in the chair, same day stuff. It's basically filling material. It's like a paste that you sculpt. You cure it right there in the chair. You can change the shape, change the shade. And if you don't like it, you take it off. You didn't have to remove any tooth structure to do the resin.
That's pretty cool.
just-
Can you get it different shades of white?
Absolutely. You can get it whatever shade you want. It's freehand. It's done right there. And if you don't like it, you take it right off. You usually don't have to remove tooth structure to do the bonding. It's usually an additive.
So you like an artist when you're doing this?
Yes, sir.
Yeah, you got to be skilled in that
Sculpt it.
department, and I'm sure it's you got to be meticulous and all that.
Right, right.
What's the other option?
The other option is a more of a commitment. It's a veneer, and you have to reduce some tooth structure to do the veneer. You can do impressions, and you typically, some temporary is going to be involved because the veneers are going to be made at a lab. So the veneers with a lab tech, who's a real artist, can do more characterizations of it, can do more staining, more translucencies, and make it, typically a little prettier than the resin's going to be.
And I'm sure with that, you said it does not stain, so that a lot of that's probably computer based when they get it. They can get it almost to the T, right?
Yeah, somewhat.
Yeah.
Somewhat. Yeah. As far as staining goes, the resin can sometimes stain. Sometimes it doesn't. Sometimes it does. It really depends on your diet, what you're eating and drinking and stuff like that. The porcelain will not stain. Porcelain's definitely not going to stain at all.
Yeah. Let's look at some pictures because you sent us some, and this will be telling to us. Yeah.
Yes, sir.
All right, let's bring up the first one if we could.
So here's a perfect example of somebody that wanted a little bit brighter smile, had some white blotches there, had some spacing, some small, what we call laterals, and just wanted a little better smile. So on this guy, we decided to do bonding on the upper front 6 teeth. So that's the pre-op. There's the post-op. So we just kind of filled out his smile, made him, a little more symmetrical, filled in the spaces.
Because that front teeth is dominant, so is that why you just chose to do that?
Well, the front 6 is really what he smiles. It depends on the smile also, what he's going to show, what he's unhappy with. So
Yeah, some people, like you can
There's his
see his
smile.
smile's the top teeth. Some people show it all.
right, so you got to be careful with that. It really depends on how much you show, and a lot of times the canines are the cornerstone of the mouth. So you got to be careful where you stop, because if you look at some people, you'll see that the front 6 teeth come out at you, but
Right.
they stopped at the canines. They didn't keep going, and if you smile and show, all the way back, sometimes you can,
Too much
it
is
doesn't look
not
right.
always good.
Right. So usually we're going to do, in a bonding or maybe in a veneer situation, we'll do the front 4, or we got to do beyond the canines, because that it makes the corner there, and it just, you notice it. You notice something doesn't look right.
Makes sense. Let's bring up
Right.
another picture if we could, because this is also telling.
So the next pre-op is kind of the same situation. This patient had some wear in her front teeth, and if you see from the canines to the front teeth, it kind of goes up, and that's what we call a reverse smile line. If the smile doesn't follow that lower lip with a nice curve, you notice that something doesn't look right. You don't know what it is, but you'll pick it up. And she's got some wear, she's got some spacing, and she just didn't like the position. You see that canine on the right side's kind of standing out a little bit, so she wanted to try and blend everything in. So she chose to do some veneers, and here are the veneers.
I tell you what, that looks very, very well done. That's a skill, isn't it? It's you really got to be meticulous.
It helps to have a good lab tech also. So yes, everything's got to come together. You just got to analyze the smile and talk to the patient and see what they want.
I bet not one case is the same as another.
Never the same. No, not every person's the same.
So every day you're like painting a picture.
Mm-hmm. Yes, sir.
That's pretty cool. I like that. And you said, just with about a minute left, people come to you because it may not be that noticeable to others, but it bothers them, right?
Right. Yeah. So I could look at them and say, your smile is fine. It's great. But if they say, no, it's not, I want this fixed. Got to take,
Right.
you got to do it.
And I bet when they leave and they see the final result, they're beaming and they can't wait to go have supper with the gang.
Yes, exactly. It just changes their whole personality. It just makes them smile more, which everybody should smile more. These are really fun cases to do. It just gives people a lot of confidence. And it's really enjoyable. It's fun.
But that's fantastic, Dr. Ron Walker, bringing smiles to people. We appreciate it. And if you are a candidate for this, or you want to know if you're a candidate, call Dr. Ron Walker, and he'll tell you, and he'll bring you through all the parameters of it. But once again, we appreciate the good doc for being here and for showcasing his talents. And certainly that is something to consider if you want to have more confidence in your smile. We appreciate it. We look for the good doc to come back, as he does each time, with a new tip for you. And once again, Dr. Ron Walker.
Watch your mouth.